Hi there. I want to welcome everyone for coming out here today. I'm State Representative Mike Fleck of the 81st District, representing Blair, Huntington, and Mifflin counties. And House Bill 1985 is in regard to the privatization of nurses within our state corrections facilities. I represent the 9th largest district in the Commonwealth out of 203 House seats. I have 2 state facilities, one of the few state reps that has 2, SCI Huntington and SCI Smithfield. But being the 9th largest district, I also come within just a few miles of Rockview over in Center County, SCI Crescent, Houtsdale. I even have a few people at the southern end of the county that are driving to Laurel Highlands out in Somerset County, as well as Camp Hill. So corrections is my largest employer. This bill is not about job security, it's about job safety. And one of the things that concerns me is when my nurses were coming to me about the possibility of the privatization. I know the RFP went out. This has been an issue in the past. Corrections nurses are a lot different than your run-of-the-mill nurse, just given the patients that they're taking care of. You'll hear from some of our other speakers here today, you know, one thing, they're not treating the same patients as a typical nurse. They treat dangerous criminals who are in jail for an array of crimes. I know in Huntington, with maximum and medium security, you know, they would love to get their hands on some of the instruments that our nurses have. So they go through rigorous training that probably, if we go through a private company that is more interested in the bottom line than they are safety, then that's a concern. Right now, amongst our corrections facilities, the rate of hepatitis C is nearly 40% in most prison populations. And we also have a high percentage of HIV and tuberculosis. They're also treating more and more inmates with severe mental deficiencies. And as the Commonwealth closes more state hospitals and former residents end up in our prison system, you can see the catalyst here taking shape, that you want highly skilled, highly trained individuals that are in there. This is a safety issue. They are well trained in state policies. They go through rigorous training at the Elizabethtown site. On any given unit, the staff has decades of combined experience with a population that private sector nurses have never had to face. It's not possible to simply replace this public workforce with private sector workers and not expect accidents or even worse to happen, given the clientele. Right now, House Bill 1985 has 51 co-sponsors. If you look at the broad spectrum of the co-sponsors, it's fascinating to find the array of individuals who typically wouldn't agree on anything, agree on this. It is from all party lines, from across the Commonwealth, as we have facilities from Erie to Philadelphia and every place in between. At this time, I want to introduce Senator David Argyle, who has Senate Bill 1342 in the Senate, and he too has a high prison population. And at this time,
thanks, Mike.
Senator.
You know, any of us that have ever dealt with a prison construction or a prison expansion program in the districts that we're privileged to represent, and I suspect each one of us here has dealt with them, the big issue is always safety and security. Safety and security. Certainly when they were starting to talk about the construction of the Frackville SCI back in the 1970s, that was the main thing on the minds of the people in the Frackville area. The same thing was true when SCI Monoy was built. That was actually the second location that had been suggested, because they originally looked at one in the House district that I had represented for so many years in Brandonville, and because of safety and security, they decided that that was a very bad location. certainly in a county such as my home county, where jobs is always the #1 issue. There's always a lot of attention paid when such a project is suggested. People want the jobs, but they're always very concerned about the potential impact upon the whole community and the safety and the security. That's why, quite simply, I sponsored this bill. I strongly support the idea of the state saving money. Last year I was honored to chair a bipartisan public-private committee in the Senate which identified $400 million in savings. And so I understand, I get that, we need to look for savings. I also understand and strongly support the idea of having the private sector do what the private sector does better than the public sector. No problem with that. But not by risking the safety and the security of my constituents. That's why I sponsored this bill. We can't hand off really important public safety protections to the lowest bidder. I mean, that's just crazy. And so I'm very, very optimistic about the future of this legislation. I'm pleased to work with a number of Republicans and Democrats in the Senate on this issue, as well as all my old friends in the House. And so before I turn it back to Representative Fleck, I'd like to turn it to Senator Tartaglione for some additional insight on this matter.
Thank you very much. Public safety is the #1 concern. And as you said, the lowest bidder does not necessarily be the right one. In my experience, whenever you privatize something, when they do scheduling in the prison, what they're going to do is they're going to short schedule, and then they're going to mandatory tell the nurses that they have to stay, because they're not bound by hospital rules. They're contracted out. So if you have a nurse who's working an 8-hour shift and there's nobody to cover for her, she's going to have to work 16 hours. This is a major concern. They are the ones that have to keep clear heads in order to do medications, as well as to protect the other inmates from disease, and also make sure the instruments in her room aren't picked up and taken away by another prisoner. This is a very, very important issue, as well as the issues that the senator and the representative also added. But I just wanted to take that time and make sure you get in your head that, you know, they don't always staff the way they're supposed to.
Thank you, Senator. We're also joined by a number of guests and nurses who have joined us here today. We also have Bill Dando from AFSCME in the back, as well as a number of my colleagues in both the House and the Senate behind us. I know Representative Stern, Senator Salabay, Representative Brennan, and Representative Gibbons. At this time, I want to turn the mic over to Kim Patterson, who's the Secretary Treasurer of SEIU Healthcare, for a few words.
Thank you, Representative Fleck. The one thing that pleases me, I guess, is that our nurses have done a really good job talking to their legislators, because the message is out. And so you may hear some things that have already been said, but I assure you they bear repeating. So I am Kim Patterson. I'm Secretary Treasurer of SEIU Healthcare Pennsylvania, and we represent over 25,000 healthcare workers, almost 10,000 of them nurses. So I think when we speak about what nurses do and what corrections nurses in particular do, I think we know a little bit about what we're talking about. First of all, I want to thank the representatives and senators behind me for standing up for supporting the safety and security at our institutions, the staff that work there, but more importantly for standing up for the safety and security in our communities. The Department of Corrections is a core state function. There's no disagreement there. And the corrections nurses are a key component of keeping the Commonwealth safe and healthy. They're more than just caregivers. All corrections staff, their principal duties are care, custody, and control. And the Department of Corrections nurses are charged with all three. The corrections nurses are a special breed. They don't work in hospitals, they don't work in nursing homes, they work in prisons, and oftentimes are called to work in prison cells to treat patients when necessary. It's a dangerous job. Any corrections officer will tell you, and they've sent letters supporting our issue, that because inmates are dangerous, it's absolutely critical that nurses and the corrections officers work as a team. To inmates who are constantly trying to manipulate and con staff, whether it's getting access to medication, an unnecessary trip to the hospital, whatever it is, it's their training and experience that really becomes invaluable from a medical and a security standpoint. These nurses also know that an overwhelming majority of inmates will be returning to their communities, and many of them, as Representative Fleck mentioned, have incurable diseases, HIV, hepatitis C. In fact, nearly 40% in most prison populations have hepatitis C, which is dangerous and can be passed on to our communities. So while many of them can't be cured, our nurses make sure that they get the absolute best care in treatment of the disease while they're incarcerated, in managing their diseases, and then training them on how not to spread that when they're released to their communities. Outsourcing will mean profit before care, which then in turn creates risks for our communities. So when we talk about risk to security, we can say with confidence that in the current system, due to tight staffing, there are times when the Department of Corrections needs agency nurses. And when state nurses and corrections officers work with agency nurses, we've been told repeatedly that the replacement nurses don't have the proper training. They don't see themselves as part of the security team, which is so critical in a corrections environment. They also aren't focused on educating inmates because they're not there long-term. They're not really concerned about the spread of disease in the institution, and they don't think about what happens after when people return to the communities. So outsourcing to a company where profit, not public safety and health, is a top priority puts all of us at risk, and we believe is a gamble that the Commonwealth should not take.
Thank you, Kim. Representative Stern.
Thank you. Some of the points that I wanted to talk about were already covered previously by Kim, but working with the prison nurses over the years, and I have the same facilities in my district. I have no correction facilities in Blair County, but we're in close proximity to SCI Huntington, SCI Smithfield, Rockview, Crescent, and as well as Somerset. And I have employees working in those correction facilities. But I want to emphasize and re-emphasize the relationship that prison nurses have with the correction officers of this Commonwealth. This legislation that is introduced both in the House and the Senate, House Bill 1985 and Senator Argle's legislation today, are both supported by the Pennsylvania State Correction Officers Association as well. They're endorsing this legislation. I think that's a key component as we move forward. We talk about safety and health issues, but it's a key component of what many in our community expect us to support as far as the safety components of corrections. Wanted to give you a little bit of a history. In 2002, the Department of Corrections contracted with a statewide vendor for selected medical care. But I just want to share this with you because of the cost factor. When we look at privatizing certain services, we want to save the Commonwealth money, not cost the Commonwealth money. But within the first 6 months of the agreement back in 2002, the vendor that was petitioned, the vendor ended up petitioning the state for additional money. DOC refused the request, so the vendor canceled the contract. That was back in 2002. One of the things in 2009, former Secretary of Corrections Jeffrey Baird ended up acknowledging the essential role not only of the Department of Correction nurses, but also of the quality health services that they provide in these various current multiple contractor agreements that are set up in the state already. But according to former Secretary Baird, one thing that he was quoted as saying, I think is key as we listen to support for this bill this morning, or these bills this morning, he said that critical to the success of managing this new multiple vendor system is a strong central office staff and well-trained on-site correctional healthcare administrators and nurses who are state employees. I think that pretty well sums up the intent of what these prime sponsors are moving toward today as we move this legislation, hopefully before the floor of the House, to keep the continuity that we have in place, the safety provisions that are already currently going on in state correctional prisons all across the Commonwealth. So I'm here to endorse and support this legislation. I'm one of the 51 co-sponsors in the House, and I'd like to thank all of you for coming.
Thank you. We have one more speaker, and then we'll take any questions. Senator Salabay.
Thank you, Mike. And I would like to thank Mike and Dave for their leadership and direction on this bill and moving it forward as it has. And, you know, knowing that there's a bipartisan connection to this thing, fighting for what we feel is important for the residents of the Commonwealth as well as our workforce and corrections. Also like to say I'm very proud to be standing here with Kim Patterson. Although maybe my looks don't appear to be, but time has done her very well. Her and I were high school partners together back at Cannon McMillan High School in Washington County, and it's kind of unique to be here standing together fighting this very important cause for the Commonwealth. And, you know, they've talked about safety and security. There's another side of this, and again, we've also talked about the importance of cost savings for the Commonwealth, but my concern is also the slippery slope that can develop from this. If it's successful to try to privatize this issue, what's going to be next? And again, just bearing down on the concerns of safety and security of the workforce that's in the prisons, the workforce that is around the prisons, and the prisoners themselves. I have 4 facilities within either within the district or very close proximity, SCI Green, SCI Fayette, SCI Pittsburgh, and the possibility of the reopening of SCI Waynesburg. I think SCI Green has probably the largest population of death row inmates in the state. So knowing the importance of the care and the fact that the safety side of dealing with those kind of prisoners is very important to know we have a trained, well-educated staff and workforce dealing with that. So with that said, and worrying and being concerned about the possibility of a slippery slope down the road with other services provided in our corrections department, I wholeheartedly support and endorse what we're attempting to do here today. Thank you.
Any questions? Yes.
Representative Fleck, do your concerns about security and safety with privatization extend to other issues within the correctional system, such as replacing guards or corrections officers with, you know, private security force or other areas within prisons?
Certainly it does, because you know, both my prisons are right beside small communities. We have well-trained staff, and you know, I think there's no doubt that the privatization of nursing care, just as a start, that they would not get the same level of training and support that they would need. As far as corrections officers and that role, we would have to address that when that comes up. I mean, that's, you know, obvious.
Yes, that you wouldn't, that is an area you wouldn't want to privatize, corrections officers.
Certainly, yes, that is a yes.
And Brad, I think if you'll check the record, the House, I don't know if the Senate's ever voted, I haven't been there that long, but I know the House has consistently voted against privatization efforts on the floor on a number of occasions.
I think it's corrections is a core system of government, so it shouldn't be about privatization just for the bottom line, which would be the intent of what we're up against. So, yes.
I wanted to ask Senator Argall, since he made a point of saying that you support saving money, do you think, though, that the Republican caucus is going to be resistant to these privatization efforts? Everybody, I'm sure, has their own issue in their own districts about why not to do this or that.
My recollection in the past for those votes in the House is whenever the issue came up at budget time when we were running all of those amendments, the vote was overwhelming against privatization. of services within the prisons, whether it's the corrections officers, the medical facilities. And so I would assume that same consensus, bipartisan consensus, would exist in the Senate as well as in the House.
I don't mean corrections, though. I mean, with the other initiatives across state government, do you think they're likely to run into problems even in the Republican caucus?
I don't know. I do know that corrections is different. I think we heard that several times here today. And so for myself, I wouldn't rule out privatization in other state agencies, but not within the Department of Corrections.
And I would echo that. Corrections is vastly different. You know, it is a core function of government. You know, when you start talking, you know, liquor stores and everything else, I don't know that that's a core function of safety and security as some, you know, may think it is. But, you know, we're dealing with, you know, health and safety and welfare.
Really my question. My question is you see a situation here where, even in the Republican caucus, which you would think be more predisposed to supporting privatization, you see whatever it is, whether it's liquor, privatization, whatever, somebody's faction stepping forward and saying, no, not this, because they can make an argument for that it's a public safety issue too.
I think you'll always see people stepping up, whether or not they have, you know, 51 co-sponsors and a broad spectrum of support is another thing. So,
I mean, you really don't think that other privatization efforts are going to run afoul of the Republican caucus?
I can't speak for the Republican caucus. I can just, you know, speak in regard to corrections and what that means for my district and safety and security.
Are medical services in the Corrections Department already under private contract?
That may be a better question for Kim. I think that there are some situations that have arisen over the last several years. Yes.
There are 2 prisons currently, SEI Pine Grove and SEI Chester, that were opened private, and we were successful initially in getting a quality assurance nurse that is a bargaining unit nurse so that we can communicate to find out what's going on. It's part of where what I mentioned earlier about agency nurses, it's part of where that argument comes from. What we hear about these private prisons, about working with agency nurses, is that turnover is pretty high, and particularly in the private prisons, because it's a very dangerous job.
So are you saying Pine Grove and Chester are...
They were opened privatized and have remained privatized, yes.
The others, no?
The others, no. There may be some, I think there are some medical, the prescription pieces, but in terms of staff, the nursing staff in our prisons everywhere else are bargaining unit or state nurses.
All right, any other questions? Thank you.